Well, this morning, coronavirus cases in nursing homes continue to explode across the state.
Now, there's such a focus on those facilities because listen to this, nearly 1 in 5 cases in the state are from nursing or residential care facilities, and nearly half the state's deaths. At this time, there are nearly 70 outbreaks at centers across the state. Families of residents at Huntersville Oaks are feeling blindsided. They found out patients who tested positive were being moved into the facilities where their loved ones live. And families told Channel 9's Deshaun Brown their elderly mothers and fathers will be forced out as the center opens its doors to more coronavirus patients.
My biggest concern is how it was done.
By this time Monday, several patients and residents from area nursing home Huntersville Oaks will be moving out and relocating to other homes within the region. Meanwhile, other patients who've tested positive for COVID-19 will be moving in.
We weren't including in any decision. It was like told, this is what's happening.
This woman says her mother's lived here the past 5 years, but she found out Friday she was now being moved to Monroe. Her mother suffers from dementia.
Alzheimer's patients have been proven with dementia that they cannot handle change very well. This could put my mother into a tailspin. I want everyone to have care. I think it's just unethical for them to disrupt the lives of so many.
In a statement, Atrium Health, which runs Huntersville Oaks, said they are strategically moving patients who have the virus to Huntersville. The facility, it says, is one of few in the state capable of caring for COVID patients. Here is an excerpt from a video released by the state's healthcare facility's CEO.
I think the approach, the very thoughtful, planned out approach that Atrium is taking here to transfer patients still within the same local geographic area to relocate those individuals to facilities that are COVID negative sites will not only protect them to the best extent possible, given what we know today, but also be a service to other individuals in skilled nursing facilities in the area.
Another family asked, then why not notify them sooner?
I feel like the information is being given to the families after the fact. It's like someone coming in and telling me I have to move out of my home. That's their home. She's been there 2 years. It's just a lot. She's very stressed. We're very stressed.
Atrium did send Channel 9 a statement from the American Healthcare Association. And while it didn't say why it waited to tell families, it did say that Atrium is setting an example for other facilities. The statement says by creating a facility just for positive residents, they're ensuring that care can be provided for those who need it while also protecting the health and safety of all residents.
The number of COVID-19 cases across North Carolina is still going up. Across the state, there are more than 8,600 confirmed cases, an increase of more than 500 with 289 deaths. Mecklenburg County at 1,450 cases, 31 new cases since Friday afternoon, and 41 deaths. And in Mecklenburg, we'll likely see more details behind those numbers in an update tomorrow from the health department. In South Carolina, there are 5,200 cases and 166 deaths. That is an increase of 180 new cases and 9 deaths.
Well, in North Carolina, more than 100,000 coronavirus tests have been done. And in South Carolina, half as many. Dr. Anthony Fauci says the entire country needs to double the coronavirus testing in the coming weeks.
Dr. Fauci, who's been advising the president, believes it is possible. We are talking about millions of tests a week. He explained it during the weekly COVID-19 webcast yesterday.
We don't want to get fixated. Right now, we're doing about 1.52 million per week. We probably should get up to twice that as we get into the next several weeks, and I think we will.
In this case, Dr. Fauci is referring to testing for the coronavirus itself, not COVID-19 antibodies. He says that the U.S. needs enough testing to respond to more outbreaks as those social distancing guidelines are relaxed. The CDC revealed 6 new coronavirus symptoms. Some we've been hearing some reports about with the virus, and they include chills, repeated shaking, muscle pain, headache, a sore throat, and sudden loss of taste or smell. I've heard that one a lot. The most common symptoms of the virus are still shortness of breath, a cough, and fever.
Well, people with medical experience have been helping out however they can.
And actually jumping in and helping can be difficult in a number of ways. And as you could imagine, some who know you're around infected people, they might get nervous. And Channel 9's Aaron Edwards heard from a woman helping during an outbreak, put out of her hotel because of it.
It feels terrible.
Tony Thomas came from Eastern North Carolina to help at a nursing home in Salisbury that's short-staffed. Her company management arranged a room for her at Home 2 Suites by Hilton. On Wednesday, Thomas says she made small talk with a hotel employee who asked why she was staying here.
I'm a traveling medical corps and I'm here to help out. And she asked if I had any patients on caseload that are COVID-19 positive. And I said, well, I can't, talk about really the building that I'm in or anything like that. But yes, we do have, those clients.
The next day, Thomas says staff would not enter her room.
They left bath towels for me out on the hallway floor.
Then Friday night after work, she found her room key was deactivated. She says the front desk told her she had to leave that night.
All I wanted to do when I came home last night was eat my hot meal that I brought home, take a shower, and get into my room, and I was blocked out of my room. It's so cruel.
But in a statement to Channel 9, hotel management said after learning she was in contact with people who tested positive, out of abundance of caution, it, quote, saw a way forward that was both hospitable and reduced risk for our team members and other hotel guests. On Friday, we shared with Ms. Thomas that we had arranged alternative accommodations at no cost to her or her company. But Thomas says she was never told about alternative accommodations until she got an email at 4:30 this morning with a new hotel confirmation.
I'm here from the other side of the state to help this community, and it feels like I'm being stabbed in the back.
The hotel told Channel 9 that they didn't want to make this any more difficult for someone who's been trying to help, and they hope that she stays healthy. They eventually gave her a refund and another place to stay close by.
Well, it's all of the talk online. Is another stimulus check coming? Well, we wanted to break down the proposal out there for another stimulus. Take a look. 2 Democratic congressmen introduced the Emergency Money for People Act. This would give Americans a monthly check until employment gets back to normal. It's $2,000 a month. $4,000 for married couples and $500 for each child. So a family of 4 could get $5,000 a month. There would be limits to this, though. If a single person makes more than $130,000 a year or a married couple makes $260,000, they wouldn't get this money. Now, it's certainly getting a lot of traction online, as you can imagine, but political experts say it probably won't happen in this current form. Members of Congress and the president have all said that we need another stimulus soon. But they've got different ideas for it, from helping you with money to pay your mortgage or your rent, to helping companies keep paying you and possibly even hire more people, and even spending money on infrastructure projects to get Americans back to work.
As it stands, students at the University of South Carolina are expected to go back to school in August. During a conference call Friday, the school's president said they are hoping for either a full return or a phased return in fall. It is unclear if the university's athletic schedule will resume when school starts back up. Duke University's president created 2 teams to plan a post-crisis strategy for the school, and there are no dates on when the school will reopen or under what circumstances, but the president says he's committed to getting back to business.
Well, this week, Myrtle Beach city leaders will discuss reopening public beach access. This is video from North Myrtle Beach. It reopened beach accesses shortly after Governor McMaster lifted those restrictions last week. Myrtle Beach decided to keep them closed, but city council will meet on Tuesday to reconsider. Some beaches in North Carolina have reopened, but with restrictions. Wrightsville Beach and Oak Island are only allowing people on the beach to exercise, no sunbathing or fishing. Carolina Beach is considering doing the same.